The notion of service to humankind is very important. The Sisters of Bon Secours began in 1824 in Paris, France. A group of nuns decided to leave the confines of their convent, go out into the city, and live with families and take care of dying loved ones. They came to America in the late 1800s. Since then, many hospitals have been opened along the eastern seaboard. Today, that translates to attending to human dignity and attending to pain and suffering at the time of death.
Bon Secours Palliative Medicine is part of a larger mission that Bon Secours has to care for the poor and dying. 10 years ago, not many physicians or healthcare workers knew what palliative care meant. Palliative actually means to cloak, and that means that we focus on quality of life and what's important to the patient. We cloak them, we support them with what's important to them, to help that patient and family through the most difficult parts of their illness. And that's where the palliative medicine team at Bon Secours may get involved. Care is focused on how people feel and what's important to them, and matching the health care to those needs. One of the major benefits is actually they could potentially even live longer. One thing that we're very proud of is we actually achieved the Joint Commission for Advanced Certification for Palliative Care with the palliative medicine program here for 3 of our hospitals in Richmond. This is a unique honor, and only about 90 hospitals across the country are currently Joint Commission certified for palliative care. With the mission of Bon Secours being truly focused on quality of life, palliative medicine in Bon Secours has been able to thrive. We've been able to develop a very high quality program that's truly giving back to the patients and families in need.
Hospice is end-of-life care that focuses on relief of suffering, not only physical pain, but emotional pain, social pain, existential pain and spiritual pain. Hospice is unique because we ask ourselves not what we think is in the best interest of the patient. We just ask the patient what their preferences are, what their hopes are, because we never want to take that hope away, what their fears are, because we want to do as much as we can to counter those fears. One of the most important things to realize is that hospice care is family care, and that care continues after the death of the patient. For over a year, bereavement services are offered, and we have a very accomplished bereavement department that offers a great deal of services that most hospices can't offer. I think back to Dr. Eric Cassell, who was one of the pioneers of hospice, and what he said was that hospice is not only a good thing in itself, but it has the potential to reinvigorate the entire healthcare system, to bring a more personal focus regarding the patient, to focus more on the treatment of human suffering rather than the treatment of disease processes. I'm very optimistic about the future of hospice.
My daughter was a kindergarten student, and her class had done a beautiful collage of Noah's Ark, and I purchased the original, wanted to make prints of the original, and I mentioned to them that maybe we could make a few hundred copies and sell them and raise a few $100s, and what would they like the money that we raised to go to? And one child raised his hand and said sick children, and another child raised her hand and said dying children. 6 months later, we were licensed as Central Virginia's first and only pediatric hospice program. The program, even though it's licensed as a pediatric hospice program by the state of Virginia, it's operated as a palliative care program from day one. And so we take children into the program from the time of diagnosis of a life-threatening condition, and then they're in the program until death.
Our role is to support our patients, to meet them where they are, where they're not there to dictate their care. We're there to walk the walk with them. We're here to hear the information that's given to them. We help them to hopefully make their best choices. We are here to provide a service, but we feel for what their children have, and we want to do our best to be an advocate for their child, to be a voice so that their wishes will come through. that we're not dictating what's necessary, that we travel the journey, but they drive.
Noah's Children is very fortunate in that we have been a part of Bon Secours healthcare system for 7 years. Bon Secours has been generous and kind enough to Noah's Children that all our programmatic and administrative costs are paid for by Bon Secours completely. Bon Secours has chosen not to bill for any of our services, so all the services are free to the families. Good deeds get rewarded, and I think Noah's Children is very fortunate to be one of the few programs in Central Virginia that is supported by all three competing healthcare systems.
Working together in a team environment to deliver the best care possible to patients with serious illness is such a privilege.
It is intrinsic to Catholic identity and to the mission and values of Bon Secours to uphold everything that goes along with human dignity and the incomparable worth of every human being, from the very, very beginning of life until the very, very end of life, and into whatever their faith tradition would call what comes next.